Okay, so this was a study looking at PET PSMA as a guide for patients with biochemical recurrence, looking for evidence of metastases in patients after prostatectomy with biochemical recurrence in prostate cancer. So in Israel, actually, where I treat patients, we have PET PSMA available for all patients. Usually, America is before us in getting many treatments or even imaging techniques and diagnostics. In this rare situation, we're actually ahead of the rest of the world. There are centers in America now that are starting to use PET PSMA, particularly San Francisco and a few other places where the study is ongoing. So this was a study out of San Francisco looking at trying to understand the sensitivity and specificity, essentially positive predictive value was the primary endpoint of PET PSMA. What they did was in patients whose PSA was greater than 0.2, defined as biochemical recurrence, then they did the PSMA. If they saw some light up, some area of suspicion, then they would biopsy it, and then they tried to understand the positive predictive value. How good was the PSMA showing if something was actually a metastasis or not? And they enrolled 250 patients and looked at this, and this is the positive predictive value they can see in these patients, around about 85–86%, which kind of rings relatively true for what I suspect I see in my clinical situation. Sometimes you have a bit of light up, as you see with PET scans, but you know that it's probably not really a metastasis. It's in an unusual position. Maybe it's in a lung and they've just had a pneumonia. But when they see some light up in a bone near the prostate, then obviously that's quite suspicious to me with a rising PSA, especially if the pathology from the prostatectomy was high Gleason or or positive margins. So I think that these new imaging techniques are really essentially going to become used much more frequently in the United States. We definitely find them of use in Israel.